Hello， 大家好，我们又见面了。如果这是你第一次看我的视频，你好，我是 Michelle 诗瑶，一名加拿大的注册护士。那么在上个视频，我们已经了解了如何用英语打电话预约看医生。如果你还没有看过那个视频，请去看看吧。今天我将教大家如何用英语填写病历表。那这个视频分为2个部分，在第一个部分中，我们将了解到了诊所后你会说还有做的事情。然后呢，我们会看看一个病历表的示例，来了解如何填写它。另外，我已经把这个视频的笔记上传到了我的百度网盘，所以你可以点击描述框中的连接去下载它。好了，那话不多说，我们开始吧。Once you've arrived at the clinic, you'll approach the receptionist's desk.
Oh, hi, how can I help you?
Hi, I have an appointment with Dr. Sun at 1:15.
Sure, what's your name?
My name is Michelle Leung, Leung.
Okay, perfect. Now, may I please have your ID and healthcare card?
Sure, here you go.
All right. Okay, good. And then, okay, here you go. All right, may I please also see your proof of vaccination?
Yep, for sure, here.
Okay, great. Now, may I please also take your temperature? Beep. All right, now please take a seat and fill out these forms here. Here you go.
When it's your first time at the clinic, you'll be asked to fill out new patient intake forms. So one of these forms will be asking you about your medical history. Let's take a look at an example. So here's an example of a patient history form. This form is from Johns Hopkins Medicine. I did not create this document and I'm only using it for educational purposes. Also, please note that Alex Lee is not a real patient and the information that I'm going to fill out does not belong to a real patient. So everything has been made up for educational purposes. All right, now let's begin. I'm going to fill out this form as if I'm Alex Lee. So today's date, we'll write that it's May 15th, 2022. And also for the name, I have Alex Lee. So Alex for the first name and Lee for the last name. So birth date, it's January 1st, 1984. And I am 38 years old. So for sex, I am a female. So how did you hear about this clinic? So it is in my neighborhood. Now briefly describe your present symptoms. So describe briefly your present symptoms. I've been having episodes of dizziness accompanied by nausea and vomiting for the past week. Please list the names of other practitioners you have seen for this problem. So basically, it's asking you, have you asked other doctors? And no, this is the first medical visit regarding this concern. Next is psychiatric hospitalizations. Include where, when, and for what reason. So I wrote NA. NA stands for not applicable. Not applicable, which means that this doesn't apply to me. Next is, have you ever had ECT? So I wrote no. ECT stands for electroconvulsive therapy. Have you had psychotherapy? No. All right, now we move on to current medications. So the question is asking, do you have any drug allergies? No or yes? So I wrote yes, I do have drug allergies. To what? Amoxicillin. So amoxicillin, when I take it, I get rashes and heart palpitations. Now it says, please list any medications that you are now taking and include non-prescription medications and vitamins or supplements. And it wants me to name the drug, so give the name of the drug, and also give the dose, so include the strength and the number of pills that I take per day, and how long I've been taking this medication. So number 1, we have losartan potassium in 50 mg and hydrochlorothiazide in 12.5 mg. And I take it 1 tab in the morning daily since 2017. Number 2, I'm taking Yasmin 28, and it's drospirenone 3 mg and also ethanol estradiol 0.03 mg. So I take 1 tab at bedtime daily, and I've been doing it since 2013. Number 3, I'm also taking glucosamine 500 mg, and I'm taking 1 tab once daily as a supplement, so it's not prescribed. Now they're asking me about my past medical history. Do you now or have you ever had the following medical conditions? So all of these medical conditions. Well, I'm Alex Lee, and I've only had high blood pressure, or I currently have high blood pressure. So the rest of these I'm not going to translate, but feel free to look them up and see if they apply to you. Okay, next is personal history. So they want to know, were there any problems with your birth? Please specify. So be specific. No, there were no problems with my birth. Where were you born and raised? I was born in Guangzhou, China, and I moved to Canada in 2011. What is your highest education? I'm a college graduate. Marital status. Are you married? So yes, I am married. What is your current or past occupation? So what is your job? I'm currently a manager at Brooklyn Bank. Are you currently working? Yes, I am. How many hours per week? So I work 40 hours per week. And then asks, if not, are you retired, disabled, or on sick leave? But none of these apply to me, so I don't check any of them. Do you receive disability or SSI? So SSI stands for Supplemental Security Income. Yes or no? So I check no. And then it asks, if yes, so if you answered yes to this, for what disability and for how long? Have you ever had any legal problems? Specify. So no, I haven't. Religion. What is your religion? I'm Catholic. So now they want to know about family history. So if your family members are living, then you fill out this part. If they are deceased, then you fill out this part. So they want us to fill out the ages, the health and psychiatric concerns that they have, and then if they're deceased, they want us to fill out the ages at death and also the cause of that. So my father is 64 years old. He has hypertension. My mother is 59 years old and she has diabetes. And my siblings, I have a 32-year-old sister and no concerns for her. I have 2 children. I have a 12-year-old son and a 10-year-old daughter, and no concerns on their part. So extended family psychiatric problems, past and present. So it's asking for your maternal relatives, so on your mom's side, and your paternal relatives on your dad's side, do they have any psychiatric problems? Whether that's in the past or the present. Now I also added in this part here. So extended family health problems, past and present. So for the mom's side, maternal relatives, my mom's father passed away at age 62 from pancreatic cancer. Paternal relatives, my dad's mom, who is 89 years old and still alive, had cervical cancer at age 43, but that's been resolved and she's had no problems since. Next is a systems review. So right now we're gonna go through all the body systems, the main body systems, and then we're gonna see if we have problems in those systems. So the question is asking, in the past month, have you had any of the following problems? So I've had fatigue, yes, and weakness. For my muscle, joints, and bones, I've only had joint pain. Where? In my right knee. Ears, I don't have any of these. Now for the eyes, I've had redness and I've had dryness. Throat, everything has been good. Heart and lungs, no problems there. Nervous system, so I've had headaches and dizziness, but nothing else. Stomach and intestines, so I've had nausea and I've had vomiting. Skin, I haven't had any of these problems. Blood, no problems. Kidney, urine, and bladder, no problems. And women only, no problems here. For psychiatric concerns, yes, I've had excessive worries. I've had difficulty falling asleep. I've had difficulty staying asleep. And I've also had poor appetite, stress, irritability, and poor concentration, and also anxiety. Do you have any other problems? Then I can list them here. All right, this section is called Women's Reproductive History. So they want to know about the age of my first period, which was 13, the number of pregnancies I've had, which is 2, the number of miscarriages, NA, so again, not applicable, number of abortions, again, NA. Have you reached menopause? Yes or no? So no. But if I answered yes, then I would write at what age. Do you have regular periods? Yes or no? So yes, I do. So next is substance use. So here we have drug category. So they say circle each substance used. And then they also want you to share the age when you first used this. So when did you first start? How much and how often did you use this? How many years did you use this? When did you last use this? And do you currently use this? Okay, so here's an example. I circle alcohol because I drink alcohol, and the age when I first started was 18, and how much and how often did I drink, or do I drink? I'm a social drinker, so I do social drinking, and I do 1 to 2 glasses per social gathering. How many years have I been drinking? It's been 20 years since I'm 38 years old. And when did I last drink? So I drank at dinner last week. And do I currently use this? Yes, I do. So these are the other substances. I'm not going to go through the entire list, but you would read through them and then you would check box yes if you use it, no if you don't. Okay? And that's all there is to it. Once you're done filling out the forms, you hand them back to the receptionist and she'll take your medical history form and put it in the examination room for the doctor to consult during your initial appointment. All right, I'm done filling out the forms.
Thank you. Now please take a seat and we'll call you in.
好了，那今天就到这里了，谢谢观看。我希望大家现在可以更轻松地用英语填写病历表。在下个视频中，我们将看一个初始预约的例子，来了解医护人员可能会问什么问题，以及你应该如何回答这些问题。好了，那感谢收看，我们下次再见，拜拜。